Good morning from the 17 newsroom. We're breaking in to bring you the live update from county officials on the COVID-19 outbreak here in Kern County. This morning, 220 new cases were announced and 2 new deaths. Let's take you live now to the county board chambers for the latest. This is Matt Constantine with Public Health.
Skilled nursing facility are reporting cases, so that's up. And we do have a number of facilities that have actually have higher numbers. We've talked often about Kingston and Valley Convalescent, but the Orchards post-acute care has some significant numbers. The Rehabilitation Center of Bakersfield is also experiencing a number of positive cases in residents and employees. And Windsor Post-Acute Center of Bakersfield is also experiencing a number of cases. So that is a concern to us, of course. Because of that, and in response to that, we have conducted site visits of each one of these facilities with our emergency medical services team. We've been to every one of them. We are now doing joint visits with the California Department of Public Health once these facilities submit their mitigation plans and they're approved by the state. The state and the county are then returning and going through. We are looking at how PPE is used. We're reviewing their mitigation plan. We're looking at infection control standards. We're ensuring that they are grouping positive and negative residents together. And we're actually asking the employees to show us how they don and doff PPE and how they cohort to make sure that it's practically being implemented. And then finally, our testing team has been active. Today marks the last facility. We are at River Transitional Care. That will complete the testing that we have done at the county's resources. We will have tested more than 2,300 employees. This started on May 15th and will now end today. This was done because at the county level, we viewed this as a significant risk to the residents. And although there is a requirement now from the state that each skilled nursing facility develop and deploy a testing plan, we didn't want to wait. The expectation, of course, is now that these facilities have been tested by us, they will implement their required testing plan and continue routine testing. And then finally, which we haven't mentioned recently, is our temporary isolation units that are at the fairgrounds. Today, we actually have 12 individuals that are isolated at these trailers. There's 7 trailers that are occupied, but there's actually 12 individuals that are being cared for at the site. With that, I'll turn it back over to Megan.
Thanks, Matt. Really quickly, an update on our testing sites. We still have our 11 sites. Some of those county funded, some of them state funded. We've completed over 22,000 tests to date. We do want to acknowledge that some of the labs are reporting a longer turnaround time. So if you're seeing a delay in getting your results, that's possibly why. We also want to bring your attention to an address change. Rosamond is now located at 3611 Rosamond Boulevard, which we did not announce last week. So if you're in the Rosamond area, recognize that the address has changed. And with that, I will pass it over to our Chief Administrative Officer, Ryan Alsop.
Good morning, everybody. Today, nearly 80,000 Kern County residents have been tested for COVID-19. Nearly 73,000, or 92% of those tested negative for COVID. We're seeking the results of 727, or about 1% of the total number tested. And today we have 5,979 residents, or about 7% of the total tested who have tested positive. Of the 5,979 residents who've tested positive for COVID, 5,754, or 96% of those people are either fully recovered or are isolated at home and recovering treating their symptoms on their own. And again, this percentage has been consistent on a daily basis from very early on in this pandemic. Today, 145 residents, or 2% of those who've tested positive, are receiving some form of care in an area hospital. 89 residents, or about 1% of those who have tested positive, have passed away. Some information on the state Public Health Department's monitoring program of counties. There are about 26 or 27 counties that are on the state's monitoring list. There are three really important categories that we're tracking, that the state is tracking, that determine what our status is, whether we are on the watch list or not. Those categories are testing positivity rate that's a 7-day average with a 7-day lag. Today, Kern County's testing positivity rate is 3.03%. The state's goal is to be below 8%. We are at 3.03%, so that's good. Our case rate per 100,000 people, this is over a 14-day period, is currently at 85.2. The goal that the state lays out for counties is to be below 100. So that is a good mark. The percentage change in the 3-day average of hospitalized patients today in Kern County is 10.25%. The state's goal is to be at 10% or below. So we are right there, just over the 10% mark. It was higher over the last few days. We are trending downward, so that is good news. Hospital beds, we have 939 hospital beds available throughout our county, 82 of which are ICU beds that are available. Some information on our Kern Recovers program. To date, we have distributed out over $18 million in funding to 634 small businesses across 203 different industries in Kern County. The average loan to date is a little over $27,000 in about 17 days from application to funding, which remains good, I believe. The program is open to dine-in restaurants, bars, movie theaters, family entertainment centers who may have already also received PPP from the federal government. The governor has ordered your industries closed at least for 3 weeks. It could be longer, but we are opening this program to you. If you have already received PPP, you can also apply now to receive the funding that remains to be distributed. We, late yesterday, added nonprofit organizations to that list. So if you are a nonprofit organization in the 501c3, 501c6, or 501c19 categories, and you have previously received federal stimulus funding through the PPP program, you can today also apply to receive county financial assistance. So we would ask you to, again, go to kerncounty.com where we have information on our website about how you can do that. We have 4 lending institutions. You need to pick one. You don't have to be a member. They will assist you. And I would urge you to do that as quickly as possible while money lasts. And it will not last for very much longer. We're moving this money out at a very rapid pace. I believe $4.5 million has been about 25% of the total amount of funding that we have had available has gone to restaurants and bars. I think that's good. I'm very happy to report that. But we ask you to apply if you're in any of those categories today. The PPE program that is also part of our Kern Recovers program. This is the county's program to distribute personal protective equipment to Kern County small businesses. We are targeting 5,000 independent small businesses throughout the county. This program is up and running. It provides masks, gloves, sanitation wipes, hand sanitizer, etc., at no cost to you. We're distributing 2-week supplies of this for your staff and for your customers. There are 16 distribution points across the county. You must fill out a simple application and schedule your pickup of these supplies at any one of these 16 locations, obviously the one nearest you. You need to go online at kerncounty.com under the Kern Recovers program tag to get information, to fill out an application, and to figure out how you can pick up your supplies. And lastly, before we get into questions, I wanted to say thank you to our county employees. I want to say thank you to our public health department and our public health team, our epidemiologist, our public health director, their team, working around the clock through this crisis, our EOC staff, staffed by members of our fire department and others. This is incredible work that's being done, and it's difficult work. The amount of work and time, resources going into managing this crisis is considerable, and I just want to thank all of those employees. I also want to thank my staff for all the work that they're doing on a number of fronts related to COVID. Before I have Megan come up and get into the regular Q&A process, I did promise a member of our community who emailed me with a couple of questions. I believe she's from the Kern River Valley, that I would, as a courtesy to her, have those questions answered at this press conference today. And I'm going to do so. I'm going to pose the questions, and I'm going to ask our lead epidemiologist to come up and answer them. These are things that have been discussed before, but I think it may be a good idea to have them discuss again. So the first question is, once someone tests positive, what is the standard treatment, care, and testing regime that will allow them to return to work or even commune with their family? And the second question that I think can be answered along with that one is, once you display symptoms, fever, body aches, etc., and you get a positive test, how far back do you go to let others know that perhaps you were contagious before the symptoms? So I'm going to ask Kim Hernandez to come up and answer those questions. Thank you.
Good morning. So in order to help everybody understand the processes that we go through at the Public Health Department, we wanted to make sure everybody was aware. The CDC considers a person infectious with COVID-19 2 days before the symptoms started. So for example, if my symptoms started Thursday today, I would be considered infectious starting on Tuesday, 2 days prior. And so at the Public Health Department, that is what we look for in identifying close contacts to people during that infectious period. So you start being infectious 2 days before your symptoms start. You remain infectious until you meet CDC's criteria to be released from isolation. The criteria has multiple pathways to release patients off of isolation. The main one that tends to be used most often is called a symptom-based strategy, where we're looking to meet 3 specific criteria set forth by CDC, which includes that the patient has no fever for at least 3 days without the use of fever-reducing medication. The patient has to have improving respiratory symptoms, and it must be at least 10 days since the patient's symptoms started. Once patients meet that criteria, they can be released from off of isolation based on CDC's guidelines. There is another mechanism for releasing patients off of isolation that includes retesting patients. That is recommended by CDC only when the specimen collection materials for testing, the laboratory capacity for testing, and the accessibility of testing for patients are all ample and easy. And so there are multiple mechanisms to release patients off of isolation. So for a person who has tested positive with COVID-19, the people who you are most concerned about exposing are those people that you have seen 2 days prior to your symptoms starting through that time period when you meet the criteria for release from isolation. It should be noted that when there are close contacts, and CDC defines close contacts as people who are within 6 feet for more than 15 minutes, that those close contacts need to quarantine for up to 14 days because the incubation period, the time between being exposed and developing symptoms for COVID-19 are anywhere between 2 and 14 days. We get a lot of questions about people who have been exposed asking if they should be tested. In general, testing is recommended if an exposed person is experiencing symptoms. If you are not experiencing symptoms and you have been exposed to someone with COVID-19, a negative test result does not shorten that time period where you need to quarantine. For example, if I get tested on day 2 and I am negative on day 2, that doesn't mean on day 5 when I start developing a fever and a cough that I won't test positive. And so we ask all of our residents who are close contacts to a case to stay home, quarantine at home until 14 days from your last exposure to an infectious case. Thank you. I hope that answers your questions.
Thanks, Kim. We'll follow our usual process. We'll go down the list. Remember, it is *6 to unmute. Our first outlet is channel 23. Anyone on the line?
Good morning, this is Tori.
Go ahead, Tori.
Hi, so we saw the numbers come out today showing that there was obviously a little bit over 200 cases. Our first question, I guess I should say, is, we saw a spike both holiday weekends, so we're wondering if those numbers are now comparable. So we're wondering about that and whether or not this is actually the highest spike in one day that we have seen.
Thanks for the question, Tori. We're going to have Kim respond. Give us just a second.
Hi, Tori. So a couple of things to make a note of is that even though we have reported more than 200 cases today, most of those cases the specimens are collected over a period of time. It's several days, so they weren't all positive today. And so because of the lag we're seeing in some of the laboratory results, as well as people when people decide to get tested, how many days of symptoms they wait before, it's not necessarily that this is a point in time, 200 new people are symptomatic and infected today. This stretches out over the course of a week to a week and a half. And it's, knowing that there is a lag time in our laboratory test results that a lot of our patients are experiencing now, it would probably, it is difficult for us to link the 200 cases reporting out today to, say, the 4th of July weekend, because for many of those patients, their symptoms may have started after that, or the ones that we are reporting may have started sooner than that. So it's not a real fair comparison to compare, say, the 4th of July holiday to the Memorial Weekend holiday. But we do know that we're continuing to watch, and as we track with patients, ask, in the time period where they might have been infected, what activities were they going through?
Okay. And then the second question that I had, there's been a lot of discussion nationally about schools reopening in the fall. So our question for public health is whether or not you guys are going to be recommending or providing those recommendations to our local school districts in regards to reopening in the fall, and whether or not you guys support reopening in the fall. I know that, Constantine has already kind of shared his perspective on this, but this has obviously come back center stage, so we're just trying to follow up on that.
We'll have Matt respond to your question, Tori.
Tori, good morning. So the California Department of Public Health has put out some guidance, some very specific guidance on just this, on schools reopening. So we would encourage our local school districts to follow those guidance documents. I think it's 13 pages, but it's pretty packed with good information, and it has some real practical advice on what to do, but that also has some significant limitations for large school districts on how to implement some of these best practices, from distancing and being on a bus and face coverings. So they're not easy to quickly do. We're also encouraging our school districts to develop plans in case there is a positive child or a positive staff member about what to do, and plan that out now in advance so that we have a plan in place if that was to occur. So we are supporting the schools. We're encouraging strong adherence to the guidance documents because that will help limit spread. And, you know, our involvement is to help them and to advise the school districts on how to do this safely. Tori, does that answer your question?
Yeah, absolutely. So it sounds, obviously, the graduations, I remember that you had said, you know, we're advising that not to happen, and graduations essentially still did happen. So definitively, you're just asking these school districts to refer to the guidance just so I have that clear?
So yes, now it's important to realize that some graduations did not occur. Some were done as a kind of a drive-in or processional kind of event in a car to help limit exposures. I think some schools that chose to do graduations, from what I have seen, did a really good job at trying to provide space and separation between non-households. But yes, with school reopenings, if they can do it safely and they can instill those guidance document practices, I think it can be done safely.
Okay, awesome. And then there's only one last question, and I can pass it off if you guys don't mind. It's just a follow-up to something that's been brought up here in the past. The Primrix Farm, are you guys working with the state about the high number of positive cases that we are seeing among our farm workers at that specific farm and just in general?
So Kim might be able to help us out with the specifics. I'll answer the latter question first. Yes, we are actually trying to work with a lot of those that work in the fields. We've partnered with and we mentioned this before about the Central Farm Workers Foundation. Supervisor Couch's office has actually been really helpful in trying to develop a mobile testing site that could actually go out into the fields at certain times using providers out there, so that would help reduce the cost. So we hope that is something we can deploy quickly. We just are reviewing that now. And Kim, do you want to talk a little bit about, I know you've mentioned it. I'll turn this over to Kim.
So as has been mentioned, you know, we work with a number of employers to help them with best practices and draw those circles around cases and contacts to help identify which staff may need to quarantine at home and not come to work, as well as how we can support them and their staff who are indeed positive patients. So this is one that we have mentioned before that we are working with. We are working with a number of employers throughout our community in order to support them through this. We know that it is difficult and sometimes confusing and trying to navigate getting their employees safely back to work and continuing to protect all of their employees. So the Public Health Department continues to reach out to them. They reach out to us often, and we provide as much support as possible to help make sure we continue to keep our community safe.
All right, thank you.
Thank you, Kim. Our next outlet is Kern Soul. Anyone on the line?
Hi, good morning. It's Elizabeth from Kern County News. My question is about the temporary isolation facility. I'm just trying to understand a little bit more about it. So when were patients first placed in that facility, and can you explain why they were placed in that facility versus being at a regular hospital where beds are available?
I can answer that one if you want me to. Okay. So the TIUs, those facilities at the fairgrounds are actually dedicated to our homeless persons here in Kern County. It's for those who do not need isolation in a hospital. Maybe their conditions don't warrant that level of care, but they don't have a home to go to that they can keep themselves quarantined. So they are dedicated to our homeless individuals here in Kern County. Does that answer your question, Elizabeth?
Yes, thank you. I thought it was for like hospitalizations, but never mind. That totally answers it. Okay, thank you.
No problem. Any other questions?
No, I'm good. Thank
Okay.
you.
Mojave Desert News. Okay, Channel 29. Anyone on the line?
Hi, can you guys hear me?
We can. Go ahead.
Hi, this is Tim from Channel 29. Good morning, everyone. A couple of questions for you. One thing I know Mr. Alsop mentioned hospital beds. Our hospitalization rates, there were reports that over the weekend, Mercy Downtown or Mercy Southwest, had to turn folks away. Are we concerned about the rate of hospitalization here in Kern County and their rise?
Hey, Tim, I think Matt is going to respond to your question.
Perfect. Thank you.
Tim, good morning. And yes, so this is an area that we are now starting to track closely. The state tracks beds and ICU beds, which are helpful to know. But as we're learning now, staffing of those beds might be the limiting factor and not the actual bed space. So Mercy did have a high caseload over the weekend. They had plans in place. They worked. They did reach out to the county for assistance. To my knowledge, they didn't turn anyone away. We still have some capabilities within the system. There are times at any hospital, depending on traffic and staffing, where they could be a higher workload at a certain hospital. That's normal. This is what they're good at. They manage these localized issues to try to move people around to make sure that they get the best care. We did offer to divert 911 traffic for about 12 hours to give them some reprieve to regroup and to reassess their current conditions, and they did it well. There are a lot of different resources available. If a hospital becomes really busy, there's even other levels of resources that we can implement. There's plans in place. But staffing is the issue. As we see hospitalization numbers slowly growing and our cases slowly growing, we need to be in a position to make sure that we have not only the beds available, but the staffing available. So we're working together with the hospital CEOs, all 10 acute care CEOs, to make sure that they have the staffing. We've offered at a county level resources. What could we do to help you? We have a lot of nurses that are employed by the county, but we're using all of them to do our case investigations. There's certainly a high demand on this valuable profession, but this is something that is going to be important for us to continue to watch very closely. Did that answer your questions, Tom?
Right. Yes, it does. And I have one follow-up just on one of your points there, sir, is I have the data pulled up from the state that you just referenced in front of me. There seems to be a discrepancy between their numbers and the ones on our website locally for the number of folks being treated in the hospital. Is that just a lag in reporting, or where does that difference stem from?
Sure. I'll have Kim come back up and explain this, and I know she's talked about it previously, but it's important to recognize the difference.
Thank you.
So as we've discussed before, what we see on the state's website with the hospital bed poll and what we see on our Kern County COVID-19 dashboard is actually looking at two different metrics. The state dashboard is looking at the total number of patients in the hospital. What we show on our Kern County dashboard is the number of patients who are under isolation who are hospitalized. And so it's a slight difference, but that's the reason that the numbers are different. On our local dashboard, we're looking for patients who are indeed under isolation while at the hospital. The state bed poll will include some of those patients who have been released off of isolation, but they're still in the hospital taking up a bed. And so they are still having medical needs that need taken care of. From the Kern County dashboard purpose, we are looking for people who are isolated as those who are potentially infectious in our community, but the state website is looking at the total number of people who are in the hospital, regardless of whether or not they are still isolated.
Perfect. That makes sense. Thank you for that clarification. And my last question, if we have the time, is in terms of the testing. I know, I can't remember who it was now, someone mentioned that we're seeing some delays in the testing in terms of the lab. I take it that's just due to the higher capacity. They're more overwhelmed. are there plans in place if we keep on seeing more folks going to get tested to assist our labs, or are we just going to see those wait times continue to expand further out?
So from the state testing task force calls that we've participated in, we do know that the labs are aware. They're the ones that are reporting this, and they're trying to resolve the problems on their end. It's not necessarily for us to intervene in that process. Obviously, we're engaged in conversation, but they are doing what they can to shorten that turnaround time wherever possible.
Okay. I think that's all my questions. Thank you guys for your time. I appreciate it.
No problem. Our next outlet is Channel 17. Anyone on the line?
Hey, Megan, Kim, Ryan, and Matt, Eitan Wallace here. Staying with the labs for a moment, do you happen to have an average time as to how long the turnaround is now?
We do not. It's varied by a whole number of things, depending on the location and which lab they use. So we don't have an average.
Right. Okay. All right. Well, then my next question is, would you mind also sharing a little bit about going back to the hospitalization beds and staffing? What is the state law or requirement on staffing when it comes to specific beds, right? It's certain amount of staff per bed. Is that correct?
So we'll have Matt respond to that, Eitan.
Eitan, good morning. I don't have the state required staffing levels at our fingertips. That's, of course, something that the hospitals track very closely. Obviously, the staffing ratio is higher for those in isolation or in an ICU bed than it would be a regular hospital bed. It's our understanding, though, that CDPH has relaxed those staffing standards because of the pandemic. But what we're finding locally is that is difficult for our hospitals to reduce it because those that are in ICU for COVID-related symptoms are sick and need a high level of care. So that does put that extra burden on the system since we still have to maintain that high level of care. Any other questions, Eitan?
Yes, I'm curious. Thanks, Matt, for that. Curious about convalescent, blood donation in general. Are from what you've heard, are hospitals having to get blood donations from down south?
Was your question, do our hospitals have to get donations from blood banks down south?
Or are they?
Are they?
Are they turning to that?
Eitan, not to my knowledge, no.
Okay, thank you. And another question just about the nursing homes. Do you happen to know then, are you able to share with us how many of the deaths in Kern County of the 89 COVID-related deaths, how many of those come from nursing homes?
Kim, do you know the number? I can't read. I'll tell you what, give me just a minute, or maybe you want to go to the next question and I can get you an answer. I have to look it up.
Sure. And while you do that, just on the nursing homes, specifically, are there any nursing homes that you're most concerned about at this point?
I was going to give you that question. Eitan, so there are 31 skilled nursing facility related deaths that the state has reported to us. And to answer your second question, we talked briefly about this earlier. Again, there are a number of skilled nursing facilities that we're concerned about. There's 14 of the 19 that are reporting positive employees or positive residents. We've talked about Kingston and Valley Convalescent prior. We also have the Orchards Post-Acute that has some higher case counts. The Rehabilitation Center of Bakersfield also has some higher case counts. And Windsor Post-Acute Center of Bakersfield also has some high counts. And we're watching those carefully. We actually check in with every single skilled nursing facility every day to review the numbers, to review their needs, staffing, PPE needs, and their actual number of cases. And again, we do that every day.
All righty, Matt. And Megan, I think the final question, I believe, is for you. Just following up with what Kern Soul asked about 12 individuals over at the fairgrounds. You mentioned they're homeless. To be clear, are those individuals, do they have COVID, or are they believed to have COVID, or is it non-COVID related entirely?
So they're COVID related. So if you want a more in-depth explanation of what COVID related is, I can have Kim explain that. Hang on one second.
So in order for patients to go to the temporary isolation unit, they have to meet specific criteria. The main ones are that this person is experiencing homelessness and that person is either a confirmed COVID positive patient or they are suspected of COVID and a COVID test is pending.
Thank you very much.
All right, our next outlet is the Bakersfield Californian. Anyone on the line?
This is Sam Morgan. My question, I think, has probably been asked already or been gone over, but I was just wondering, with the increased number of cases that we're seeing, do you guys expect them to keep rising over the next few weeks? And how do you, and my follow-up would be how will that impact things moving forward if you do think they're going to keep going up?
Sam, I just want to make sure I understand the question. You're asking whether or not we anticipate the cases to continue to rise and what our plan is if they do.
Yeah.
Okay. Kim's going to respond to your question.
Hi, Sam. At this point in time, we do expect our cases to continue to keep rising. We have concerns in our community about the amount of transmission that is going on. Obviously, if we think about the incubation period for COVID-19, we have to make changes now if we want to impact, over the course of the next 2 weeks, how many people are getting infected. So we encourage people to follow the recommendations, to follow the governor's stay-at-home order, to minimize any contact with people outside of their household, to take all of the precautions that have been, we've talked about, for months now, to help reduce the spread of COVID-19 in our community. We hope to see, the cases turn around, but at this point in time, we don't have any indicators that they aren't going to continue to increase.
Sam, did you have any additional questions?
My one question is just about the stay-at-home order. I'm not sure when exactly it was made, but I thought it expired soon. Is that the case? And are we going to be, I guess not the stay-at-home order, but when the governor said dining in restaurants needed to cease, are we hoping to bring back dining in restaurants, considering that the cases are going to keep going up?
All right, we're going to have Ryan respond to that one.
Okay.
Indoor dining at restaurants and bars, whether it's indoor or outdoors, have been shut down by the state. And the governor has said that that shut down, in addition to there's some other industries included in that, Sam, at least for 3 weeks. I suspect that when that 3-week period is up, for those counties that continue to stay on the state's watch list due to any one of the parameters being exceeded in numbers, I foresee the state continuing to keep those industries operating at minimal levels or shut down entirely. So that's something that we'll be working with the state on. Again, they're making the decisions, they're giving the orders, they're providing the directives, the guidance. We are reinforcing that locally here. With that said, obviously, and I've said it before, we want as many businesses open and operating under public health guidelines safely as possible. We want to get as much economic activity happening here in our county as we possibly can, while we also deal with this virus in our community and continuing to spread. We've got to strike a balance. That balance is some economic activity, judicious economic activity, along with all of us making good personal public health choices in all of the interactions that we're having and everywhere that we're going, all the things that we've been talking about again for months. I would like to say, I think you said something about Kim answered it about numbers going up. I'll just say that expect us to be holding these press conferences on a weekly basis, reporting to you that we have increased cases every week for the next many months. That is the situation. And that is not just the situation in Kern County, that is the situation everywhere up and down the state. It's the situation in other areas of the country. This virus is here, it's spreading. We are not going to be able to stop it, but we can manage it, and we can help control the spread and slow the spread. Again, as it relates to the hospital issues that we've been talking about, and most importantly, it's not, again, necessarily the bed availability, but it's the availability of the staffing that surrounds those beds, particularly acute care, the ICU care within our hospitals. So I hope that answers your question.
Yes, thank you very much.
Okay, our last outlet is Kern Radio. Anyone on the line?
Hi, J.R. Flores, Kern Radio.
Go ahead.
Yeah, it kind of goes back to the hospitalizations and staffing. Follow up on 29's about Mercy turning, or you guys offering to turn away ambulances. Is there a concern about other hospitals reaching that same level?
Yes, there is. Sorry, JR, I'm getting an answer from the side. So yes, there is a concern about that.
What are we doing to mitigate that? And how are we, I mean, what are our staffing numbers? Do we have hard staffing numbers? I know there's models for beds. Is there like a model that shows when we're going to reach capacity for staff?
We'll have Ryan respond.
JR, we've talked about this. We're working with the hospitals, all 10 acute care hospitals throughout Kern County. The CEOs, the chief medical officers are working with our public health team to talk through this, to figure out solutions. The hospitals are very good at managing their own institutions and organizations. The flexing to accommodate patients, working with each other to help shift patients from one hospital to another where that needs to happen. Matt discussed some of the redirection on 911 calls to assist a couple of hospitals that were filling up or filled up over the weekend, over this last many days. But we are working with the group of hospitals on a daily basis to try and plot solutions to address the staffing issues. We, as Matt said, are concerned that it's not just the staffing issues here in Kern County, it's the staffing issues and the lack of available nursing staff all up and down the state. All counties are dealing with this same issue. Certainly in LA County, they're dealing with the same issue, and they're massive. When they have a staffing issue and they're needing to address that, where are they going to be bringing in extra staff? We're going to be competing with other counties like Los Angeles and other counties, other states, to try and address staffing. So we are having detailed conversations with these hospital CEOs. These conversations, obviously, Matt and his team are involved, and we are trying to figure out the very best ways to address these concerns that we have related to staffing. And we're going to do our very best. We're going to utilize county resources where we can, and the leadership of these hospitals, and in doing all of that. So that's the best answer that I can give you. Obviously, we're going to be back here in the coming weeks talking more and more about this, and as things develop and potentially as things potentially could get worse, obviously we'll be talking in greater detail about some of the mitigation measures that we're taking in order to ensure that that we've got appropriate staffing. So I hope that answers your question, JR.
I mean, it didn't give me a real number about when we're going to run out of staff, but we can move on. Is there any real urgency from your guys' office to start enforcing the guidelines? I know the state was in town over the weekend. I know you guys finally got a hold of them and who was doing what. Did you ask them to stay in town? Are you going to have them enforce the rules that you guys aren't going to enforce? Are the supervisors thinking, or is anybody in the administration office discussing passing an ordinance about face coverings?
Yeah. So, JR, back on your last question, just to make sure that you're clear on my answer, no, we don't know when we're going to run out of staffing. It is a fluid situation. It depends on a whole lot of factors. The important thing is that we are talking with our 10 hospital managers, administrators, on that subject on a daily basis, and we are monitoring it closely, and we are plotting solutions to address shortages in staffing going forward. But we do not have a date or a specific time when staffing runs out. On your other question, we didn't quite hear it because we were discussing the answer that I just gave you. So if you could please answer that again, and we'll try to get somebody up here to answer it.
Yeah, just the enforcing the guidelines part. The state was in the county over the weekend. I know you guys talked to them to find out what they were doing. Did you ask them to stay to enforce guidelines since nobody else is? And are the supervisors or your office discussing passing an ordinance to enforce the face coverings?
No, we're not. I'm not recommending to the board that they pass an ordinance to enforce face coverings. We've given no direction to draft an ordinance to enforce face coverings. No, we did not ask the state to stay and enforce. Yes, the state was here in Kern County. Our public health team had a conversation with the state task force. I believe Matt is going to be on another call today with the state task force. They engaged, just the Alcohol Beverage Control Agency engaged with 81 different restaurants and bars over the weekend, 81 in an education mode, going into those businesses, contacting their ownership, educating those businesses on the recent state orders and guidance and rules. I think there were a couple of citations I heard that were issued. I don't know what for, but with 81 businesses being engaged by the state, and a couple of citations means that the state is in the mode of reinforcing the decisions that are being made by the governor, the decisions that are being made and handed down by his public health team. That is the position that our county has been in from day one on this. We continue to reinforce with area businesses what the state's orders are, what the guidance is. We're in contact with businesses. It's either through a letter, through an email, through a phone call. We get reports. Public health gets reports on a daily basis on any number of different businesses that may be violating or operating outside the guidelines of the state. In the event that we get those, contact is made. And again, it's an education related interaction where we are simply contacting them, making sure that they're aware of what the state guidance is. If that fails, another contact is made, and eventually somebody will wind up going out and visiting them in person if the problem persists. But we have had very, very good responses to our engagement with various industries here in Kern. Typically, when these businesses are contacted, whether it's through a letter or a phone call or in person, by any member of the public health team or county staff, there are changes made, there are adjustments made so that they are operating within the orders of the state and the guidelines that are handed down by the state. So I hope that answers your question.
Is there a specific hotline for public complaints concerning non-compliant businesses? I know there's one for state nursing homes.
So the number for our public health COVID hotline is 321-3000, and the public can call that and inform the folks at that number that there's an issue.
Okay, and one last question: with the case rises, the case count rising, how many contact tracers do we have on staff, and can they handle that load?
I think Kim is going to answer your question.
In our COVID response, we have about 70 people who are investigating cases and contacting the contacts for follow-up, and that expands when you get into more in depth into the support staff that are involved in all of this. But there are a lot, and our staff are working 7 days a week. They are working tremendously hard every day to get the information we need to alert people that they may have been exposed, so those people are able to quarantine at home and watch themselves for symptoms, as well as minimize exposures to other people, particularly in your own family. And so we have a number of staff that are working on this 7 days a week. We continue to bring on more staff as obviously we are seeing increasing cases. That's something we continue to develop as this pandemic develops.
Thank you.
Thank you, Kim. I'm going to pause for a second and go back for follow-up questions. Okay, before we close for today, I want to make sure that we notify you that there will not be a briefing on Monday, so we will be back next Thursday. Obviously, if something happens significant between now and next Thursday, we will stand up another press conference and let you know about that. So we will see you next Thursday. Thank you.
All right, you've been listening live to county officials as they give the latest on the COVID-19 pandemic here in Kern County. And just to recap those numbers for you, we saw another surge again today with 220 new cases announced. And again, when those cases are announced, the health department takes them and then they allocate those cases on their graph to the day that the person was actually tested. So right now, our current peak for the most number of new cases is June 23rd. It has been June 17th for quite some time, but today it's now June 23rd with 247 new cases that were tested on that day. 2 new deaths were also identified today, bringing our death toll here in Kern County to 89 so far. 142 people are currently hospitalized. 4,002 are recovered so far from the virus. Speaking of the hospitalization number, that rate is one of the metrics that the state is watching closely here in Kern County and other counties on the watch list across our state to determine where we should be in reopening stages. And right now we're at about a 10, we're right above a 10% rate for change in hospitalizations. The county would like us right at 10%, so we're just above that. And county officials also announced that there are about 82 ICU beds currently available here in Kern County among all of our local hospitals. Another number, 3% positivity rate as far as testing goes. The state goal is 8%, so the county is below that. But again, we are currently on that watch list, and we heard last week that we were pulled back with several of those reopening guidelines being reinstituted as far as shutting down the different indoor dining here in Kern County and bars, among other services. We'll have a full update on everything that you heard right there coming up on 17 News at noon and 5 and 6. You can also go to our website for much more, kget.com. For now, from the 17 News studio, I'm Maddie Jansen.